Examiners will confuse you with two things. So there's delusion and there's the hallucination. It's very important that you know these two terms because they will trick you. It's very simple, but they will try to put it in a way that you don't know which one they're talking about. And that is the beauty about mental health. Mental health is all definition. So if you master the definition, you take it and look at the statement that it will give you. And then you convert that statement into that definition. So when you study mental health, look at the definition, expect to get a statement, and that statement has to be translated back into that definition that you know. Remember, both of them is false belief. Okay, both is false belief. Okay, but then hallucination is a perception. It's basically a sensory problem. Okay, so anything that they give you that involves senses, feeling, okay, hearing, you're hearing something, okay, tasting something, okay, and smelling, all of this is an hallucination. So when they give you a statement that has something to do with your feeling, sensory, basically all the senses, you're hearing, you're tasting and smelling, that should be an hallucination. Delusion is a complete false belief. Okay, this is like false belief, even though you have evidence, okay, despite evidence that what you believe in is wrong. Those are the keys. Okay, false belief, despite what evidence shows that you have a wrong belief. Hallucination is basically all is sensory. You're feeling, you're hearing, you're tasting, you're seeing something that is not there, you're hearing something that is not there. You feel like something is touching you, you're smelling something that is not there. And that is that. Secondly, just to give you context, then we can do the question. In delusion, there's different type of delusion. You have to know. This is why mental health is so a little bit difficult for students, the nurses to figure out. But I will make it easy for you. In the simple term definition. So delusion, there's different type of delusion. Okay. So we have delusion. That's what we're talking about now, that different type. There's one that deal with control. And based on the definition, scientists don't know anything. They use the definition to define what they have. Control. These people feel like they're being controlled. There's external forces somewhere. Forces that is responsible to control their feelings, their thought, and their action. So like the government, okay, is controlling me, is using videotape, looking at something to control me. So that's all they care about. So the statement will be something to do with control. The second one is grandiose, okay? These guys, we feel like they are superpowers or they are elevated. They have like special powers to be responsible for something. They elevate themselves, or they are in relationship, not in relationship, but they are in like elevated feeling. They have worth, you know, they're powerful, and then they have friends who are in big places, you know, like the government. They are in charge of, not in charge, but they have relationship with those people, that they have meetings with them. So those are the grandiose people. Then idea of reference. This is a little bit confusing. It looked like hallucination, but it's not. These people, when they watch TV, so they will give you something about TV or movie, or they saw a show, and everything that was done is talking about it. They're getting message, so receiving message from those things. They receive message from the TV, the movies, the show that they look, and that's the idea of reference. Then there's these people, the nihilistic guys, okay? That's another delusion. These people, they think there's no future, okay? They already dead. There's no future anywhere. and their body part is dead. Okay, body part is dead. So nothing is going on with them. They're just like floating around. So that's the example of nihilistic. It's a little bit confusing with this one, somatic, but it's not. Somatic means the body is, something is wrong with the body, even though there's nothing wrong with it. These guys think something is wrong with the body and the body is dead. So somatic people think something is wrong, even though there's no evidence of it. No evidence. So it's like hypochondriatic people, you know, something is wrong with the body, but there's nothing scientifically with them. Or medically, you can say there's nothing medically wrong with them. So that's that. Then this is what most people know, prosecutory. So they persecute, like somebody is there to get them, others is there to get them. So everything they're doing, you dare to prosecute me, basically, you dare to send me to jail or something like that. Okay, so those are there's other ones that I don't think they will give you guys. The erotic maniac, I don't like that word, but that's what it is, you know. Erotic. I've never seen that before, but in exam questions, but this is erotic maniac. That means they are in relationship with celebrity, basically relationship with somebody big, even though there's no evidence of that. These are the definitions. You try to study them carefully and trying to think about it, have example in your head, and then compare it with another question if they give it to you. So these are the 1, 2, 3, 4, 5, 6, 7 type of delusion that they can ask you questions. What is the management of delusion? Very important. Oh, okay. So what you do is, when you're managing these people, the key, okay, what is the key? The key is, I'll put it here. The key is to basically listen to what they have to say. Just listen, okay? Therapeutic listening. So listen to them, don't challenge. So this is select or apply, or that apply. The same thing. Don't challenge them. They can put this in the question for you. Listen therapeutically, don't challenge them, no argument, okay, about the belief. Don't like discuss the belief. So no discussion of the belief, okay. But listen, don't challenge, don't argue, no discussion about the belief. But your number one, okay, your number one job is to where is it? Go up here. Your number one is to bring them to reality. This is number one. So you don't go into detail to find what kind of belief. Oh, yeah. What did you see again? What did you hear? No, in delusion. No. Okay. It's different when it comes to schizophrenic, where they're suicidal. But this is different. If they have delusion, you don't go into detail of the delusion about who are they going to meet and whether you don't argue with them. You don't discuss it, but you bring them to reality. You tell them the truth. Just bring them to reality. And this is what they try to trick you with statement. Every answer choice for a delusional patient should be my idea to bring them to reality. Just bring them to where they are. That false belief, and provide them the reality information. And don't discuss the detail of their delusion. Don't argue with them, their delusion. Don't challenge them. And all you need to do is to listen and bring them to reality. So listen, it's number 2. Okay. And bring them to reality. So this is all the content I want to give you guys, and then we can answer the question. So we have a question where I put all those information together, and expect to get similar one like in your questions. That's what they will do in your test. They just taking those definitions, put them together, and try to trick you. So you know how to answer the SATA question by now. We read for the last one to find the ax. The next you expect which, so an expected finding, which statement to be consistent with the diagnosis. So that's our ax, expected finding. What is the diagnosis? Then you read your case, okay? A client with severe nihilistic delusion, so they've given you, was admitted for evaluation. What is consistent with the diagnosis? So that is the case. Buzzwords is what? Assessment, that is what you expect, and somebody with nihilistic delusion. Rewrite, delusion due to nihilistic. And that's where you bring your content before you go and make your choice. You know, nihilistics, they think they're dead. They think they are not alive. Therefore, I'm taking this content. Your examiner will not say nihilistic. They'll give you a statement, and you have to interpret it to look like nihilistic. And that is what they ask questions on psych and mental health. So just pay attention. Start thinking about that, because those are questions you will get no matter what. I am not eating in the dining hall. The government will get you. Who is afraid of the government? They think the government control them, everything. Yeah, so this is control. It's not nihilistic. I have a special meeting with the president of Turkey this afternoon. Who does that? This is the grandiose people. And this is the control people. So this is grandiose. Grandiose people, they elevate themselves. So this one, because he has a meeting with the president. The patient speaking to be, the speaking to me, this is me, through the wall, want me to leave the hospital. So there's somebody speaking to me through the wall. So there's vision problem. You're seeing something. So this is vision speaking to me through the wall. There's no evidence that somebody is speaking to you through the wall. This is an hallucination. It's not delusion. Delusion is a false belief, even though there's no evidence of it. There's evidence of it. There's evidence of it, but they are false belief. This one, somebody is speaking through the wall. There's nobody in the wall. That's hallucination. And therefore, this is what they're trying to trick you with. This is an hallucination. There are bugs clawing on my skin. Yeah, this is not a delusion problem. This is hallucination. So this is a tactile hallucination. So that one too, it doesn't correspond with nihilistic. I'm just using this to demonstrate how they can ask you questions. Even though I make this straightforward, you just definitions. Every TV station is now talking about me. I need to go watch now. So I need to go watch it now because they're talking about me. Who think like you're getting messages from TV, radio? Yeah, somebody with an idea of reference. So this is an idea reference. It's not one of them. I died 2 years ago. Only my spirit remains. So don't bother. Yeah, this one, he said he's dead. There's no future for him. So no future is what we have as nihilistic. So this is our answer. It's consistent with the diagnosis. Let's look at the last one. They told me I have no pain on my right lower abdomen, so I don't have appendicitis. I don't know who gave them medical license. Yeah, you think he has appendicitis, but there's nothing that they can find on physical exam. So they told him you don't have appendicitis. But he believed that he has an appendicitis. So he false belief without scientific evidence. So this is somatic. So we only have one answer choice. Like I've said multiple times, this is how you should study. Create yourself your own questions. Anticipate what the examiner will try to trick you. I just took the concept that we used in the beginning, and I just form a question, and you have to figure out the definition of each of them to eliminate. They're not going to give you this like that because they will pick one and keep on giving you this one. I just want to emphasize, but that's the way it is. It will give you 4 information or 6 and 7, and you have to find something that is related. This is a classic NCLEX idea of question of you finding which one is this, and which one. So as we go down, we eliminate, we're not comparing, we're just using the definition, and what we know is each individual type of delusion. This is a content level, select all that apply. Once again, thank you for listening. Take care of yourself, keep charging, and all the best of luck.